So how many of you spend your time watching dramas or movies during your leisure time? Movies and drama often portray situations which you may not encounter in your real life. However, how real can those situations be, and how true does it reflect your real life? I remember once I watched an English movie called The Heat, where a FBI agent, Sarah Ashford, played by Sandra Bullock, tried to open the airway of a choked person by making an opening in the neck. There was so much blood spurting out from the opening at that moment, and she didn't even know whether she got it right. It made me wonder about the procedure, how the procedure should be done. So, as a first-year medical student and a doctor-to-be, I began to do some intense research. When we talk about airway, most people know that it is the most important passageway where air flows into the lungs from the nose, mouth, and tracheobronchial tree. But during an emergency where there's an obstruction to the airway, most of them don't know what to do or how to act. All they know is that they should make an incision at the throat to let the victim breathe. However, the exact location is not well known. As a medical student, it is our job to know how to handle this situation. So today, I'll be talking about the techniques in performing a Bougie-Aided Cricothyroidotomy. So first, you will learn about how to identify the landmark structures and making a skin incision. Next, I will explain to you how to puncture the cricothyroid membrane followed by a Bougie incision. And lastly, I will end with an endotracheal tube placement and how to secure it in place. So before slitting open the throat of the victim, we must first identify the landmark structures of the throat, which is the cricothyroid membrane. In the article about tips and tricks for performing cricothyroidotomy by Professor Dr. Richard, an adjunct professor of emergency medicine, shared that instead of using the tip of index finger to feel for landmarks, palpate the laryngeal framework using the whole hand with what I call the laryngeal handshake. Using the whole hand, feel the hyoid, the thyroid, and cricoid at the side from cranial to caudal. Take note that the thyroid prominence is evident in male, whereas thyroid and cricoid bone is almost equal prominence in female. So after identification, slit the skin above the cricothyroid membrane vertically at about 4 mm. Bleeding is usually common and should not be worried about. So now that you know how to identify the cricothyroid membrane in both gender and make a clear incision on the skin, next I will inform to you the techniques in puncturing the membrane and also inserting a Bougie. By using a scalpel, you have to slice horizontally about 5 mm to puncture the cricothyroid membrane. Do consider about the esophagus, which is located posteriorly to the larynx. The next thing to do will be to introduce a gum elastic Bougie into the incision, which requires great caution. Remember that the gum elastic Bougie must be advanced inferiorly into the trachea to avoid injuring the vocal cords superiorly. It is important to understand why we should insert a Bougie. Randomized clinical trials that includes 757 patients in the University of Minnesota showed that the Bougie usage results in significantly higher rate of first-pass intubation success than without it at 96% versus 82%. Especially for those with a difficulty airway characteristic. It helps reduce time spent guiding the endotracheal tube into the airway. And this was reported from the NCBI in 2018. So after the slitting open of the membrane and understanding the importance of a Bougie insertion, I will move on to the endotracheal tube placement and how to secure it in place. Professor Dr. Volker Dort's Department of Anesthesiology and Intensive Care Medicine states that endotracheal tube intubation is considered the gold standard of airway management to fully secure the airway in emergency situation. The placement of it is confirmed with an end-tidal capnography. So in order to perform it, pass a cuffed endotracheal tube over the boogie up to the cricothyroid membrane and ensure that the bevel of the endotracheal tube is aligned with a horizontal incision before pushing the whole tube in. The cricothyroid membrane will be pushed laterally to allow placement of the larger endotracheal tube. And when the cuff enters the trachea and the balloon is no longer visible, stop advancing and inflate the cuff. So I'll be showing a short video in order for you to visualize how the endotracheal tube placement will be done. Okay, so you can see that they'll slide the tube down the boogie into the airway. And once the tube is fully inserted, you can remove the boogie. Okay, and inflate the cuff with about 10 cc of air. And lastly, secure it with a securement device. A permanent tracheostomy should be placed within 24 hours, as cricothyroidotomy can be used for approximately 40 minutes to avoid any glottic and subglottic stenosis, which will make the situation complicated. And this is reported from the article from Medscape known as Cricothyroidotomy by Kumar Kant in 2019. So just to let you know, there's a difference between cricothyroidotomy and also tracheostomy. Cricothyroidotomy is usually used in emergency situations as it is quicker and also easier to perform, whereas tracheostomy requires full anesthetic and can be done after a cricothyroidotomy. In conclusion, today I have explained to you about the boogie-aided cricothyroidotomy. There are three main techniques involved. Firstly, is to identify the landmark structure and also making a skin incision, followed by incision to the cricothyroid membrane and also insertion of a boogie. And lastly, the endotracheal tube placement and also securing of the endotracheal tube. I know that you must be thinking, why should we know about this now? We can learn it in clinical years. Well, George R.R. Martin quoted, "Sooner will be better than later, and now will be better than sooner." Even though we are still in preclinical years, it is never too early for us to know about the basic procedure in performing cricothyroidotomy. So, now, let's practice it to save a life. Or maybe we should wait after a real exposure during the clinical years. Thank you and goodbye.